What I am interested in to begin with is this new discovery that the virus was active in California in January, and we have now revised the timeline of death in the United States, moved it forward or backward, I should say, 20 days. What does that tell us about what we're up against if it was active, clearly active in the middle of January in California, at least?
Well, Lawrence, it's been a revelation. This is a very elusive virus. It snuck into this country unbeknownst. It hid under the guise of influenza because influenza and this virus cause very similar symptoms when they present. And it was initially not recognized. And this case, this death, indicated that it had come not directly from China, but had been spreading in the community for some time already. So this virus was way ahead of us. We've been playing catch up the whole time, but we didn't realize it had such a long head start. It was way ahead of us.
And we heard the officials in that county say if we had had testing, then we could have gotten started earlier. Where are we tonight, Dr. Schaffner, on testing, and where do we need to get to? We've seen that the United States now has just about gotten over testing 1% of the population. Where do we need to be?
Well, we've all been talking about this for some time. Our testing numbers day by day are still pretty flat. We're trying to increase that. We need to increase testing so we can identify cases as early as possible. And then once identified the cases, we can get case investigators in to do the contact tracing, find all their contacts, test them, see who's positive, get them into medical care, and isolate them so that the virus can't be transmitted to others. That's the whole way we can stay ahead of this. That, along with our social distancing and staying at home, all of those things need to really continue and to be ratcheted up if we're going to slowly but surely open up our economy in a safe and appropriate fashion.